Hello everyone, this is Devanshi and you're watching Science Cube. You must have seen some people who find it challenging to make sense of the world moving around them. They could frequently mix up what is real and what is fake. They quickly become detached from the reality and start imagining bizarre things and strange fantasies. Not only that, they also lose the ability to rationalize their train of thoughts in the right direction. In their interior world, there is always a state of delusion and dilemma. Eventually, it becomes difficult for them to process their own thoughts and feelings. Medical science refers to this condition as psychosis. Psychosis is a common terminology in psychiatry and neurology, which is often used to describe unstable mental behavior. You cannot mention psychosis as a core disease, as it is actually a symptomatic indication of severe mental disorders. In easy words, you can understand it as a byproduct that gets generated due to some underlying mental conditions. So without further ado, let us find out the what's, why's, and how's behind this strange mental state. According to global statistics, even in the developed countries like USA, around 3% of the population prominently suffers from psychosis. This makes over 11 million patients of psychosis in America alone. Similarly, in Australia, out of every 1,000 Australians, 5 are suffering from psychosis. Most people have their first encounter with psychosis between their late teens and early 30s, that is the age of 15 to 30 years. No matter which country you live in, which culture or community you belong to, or what kind of social group you have, psychosis affects all men and women equally. Little over 2 to 3% of all people experience psychosis at some or the other points of their life. In any given year, approximately 100,000 of teens and young adults suffer psychosis. Now, you might be thinking, what does psychosis actually mean? Let us understand its definition. Medical professionals define psychosis as a mental state of an individual that breaks his contact with reality due to delusions, hallucinations, false judgments, and disorganization of thoughts. A person who has psychosis loses his insight and ability to rationalize. Thereby, he experiences difficulty in social interaction and daily routine tasks. These people cannot handle themselves on their own and strictly require medical aid. They see, hear, or smell things that don't exist in reality. It occurs because of delusion or hallucination. During the constant progression of disease, the patient gradually loses his contact with the real world and starts living in the world created by his own mind. Due to the conditions mentioned above, the person tends to remain confused, disturbed, and distrustful between what's real and what's not. Suppose you and your friend are out at your favorite restaurant and eagerly waiting for the food to be served. Suddenly, you start to notice that some people are watching you and are whispering your name. You feel like something is gonna harm you and you start feeling scared. Your friend notices the change in your behavior but is unable to understand what is happening to you and what are you talking about. You feel like you have to do something before someone harms you, and boom. If you have ever experienced such a thing, or you have seen people blabbering about such experiences, it could be due to psychosis. The patient might feel neglected when nobody understands what he's trying to explain. He develops the feeling that nobody likes me and I'm unwanted. It might scare them more and they might not trust the people living around them. In such situations, psychotic patients face the problem of social unacceptance by the family and society. Psychosis makes the person forget actuality and essence of his life, and this worsens their mental conditions even more. Moving on to the symptoms of psychosis, generally, a psychotic person experiences 4 cardinal symptoms: delusion, aggression and agitation, hallucination, and disorganization of thoughts. The delusion can be any false belief or a thought that a person strangely holds. For this reason, he remains suspicious and frightened over everything happening around him. We can categorize delusion into 2 primary types based on their plausibilities: bizarre delusions and non-bizarre delusions. Bizarre delusion involves weird thoughts and feelings about patient's life, family, and surroundings. For instance, the patient might believe that some family member has changed. Non-bizarre delusions are due to the excessive fear or overprotectiveness towards something or someone. For instance, the patient might feel that his partner is cheating on him. Hallucination is a wakeful, sensory experience where the patient sees, smells, or hears the things that are not present in reality. The patient often feels scared about someone or something following to harm him. The thoughts of psychotic persons are illogical and remain scattered in different directions. Thereby, the person who is suffering from psychosis is unable to focus on any particular thought or conversation. he might face difficulty in expressing his feelings and problems due to the hindrance in speech and language. Disorganization of thoughts can lead to several other problems like alogia, that is lack of speech, word salad, avoiliation, that is lack of motivation, clanging, that is senseless speech, thought blockage, etc. The person during the psychotic episode may become violent and aggressive. In severe cases, he might not be able to control his aggression and cause harm to himself or to others. Moving on to the causes of psychosis. There can be three primary causes of psychosis: functional, organic, and substance abuse. Functional may include the mental issues, for example, bipolar disorder. Organic causes are the changes occurring in the patient's mind, such as tumors and chemical imbalances. Intake of abusive substances like psychoactive drugs is also a potential cause of psychosis. Moving on to the secondary causes. The secondary causes can involve the health issues like stroke, thyroid, adrenal disease, Wilson's disease, Alzheimer's, Huntington's disease, etc. We often neglect the mental health criteria as we think it is least important to keep our minds healthy. Thus, most of the population might suffer from mental illness without even knowing it. Mental states like psychosis are not permanent and can be cured if taken seriously. Psychosis can severely hamper your living standard, everyday routine, general behavior, and quality of life. Thus, one should take professional guidance and therapy sessions to overcome psychosis. It becomes our moral duty to support and help the psychotic persons to find this disorder. Always remember, your mental health is as important as your physical well-being, so give equal time and importance to it in order to stay entirely fit. So guys, that was all for today. Hope you found this video interesting and informative. If you liked the video, do subscribe to my channel. Don't forget to hit the bell icon, do like, share and comment your suggestions in the comment box. Until next time, this is me Devanshi signing off.